Clap. Yo.
So today I'm going to show you how to do the communicable disease technique. So what is communicable disease technique? It is infection control includes all the practices used to prevent the spread of microorganisms that could cause disease in a person. So the isolation means is to refers the measure designed to prevent the spread of infections or potentially infectious microorganisms to health personnel, clients, and visitors. So the types of isolation precaution is the category-specific isolation precaution. So it is used in 7 categories: the strict isolation, contact isolation, respiratory isolation, tuberculosis isolation, enteric precautions, drainage or secretion precautions, and blood or body fluid precautions. Next is the disease-specific isolation precaution. Provide precautions for specific disease. These precautions delineate use of private rooms with special ventilation, having a client share a room with other clients infected with the same organism, and gowning to prevent gross soilage of cloths for specific infectious disease. Next is the universal precautions. It is the technique to be used with all clients to decrease the risk of transmitting unidentified pathogens. Next is the body substance isolation. It is a system employs generic infections control precautions for all clients except those with few diseases transmitted through the air. So next is the hand washing, a very short rubbing together of all the surfaces of soap lather hands, followed by rinsing under stream of running water. Materials and equipment in the isolation cart containing is the mask, gown, gloves, plastic bags, isolation tape, germedical soap, preferable liquid soap with dispenser, running water, antimicrobial cleaning agent, linen hamper, trash can, paper towel, and card indicating type of isolation. Next is the procedure, which is the assessment. Assess what type of isolation is needed. Assess what kind of communicable disease the patient is experiencing to know the client's condition. Assess the hands for visible soiling, bricks, cuts in the skin and cuticles to ensure that the hands have no wounds, and to check for the appropriate materials needed for the procedure to avoid possible errors. Next is the planning. Prepare the isolation cart materials to ensure that the materials are ready, and assemble the equipment to save time and effort and achieve the purpose of procedure. Next is the implementation. Check position order of type of isolation to determine what type of isolation is needed for the client. Obtain isolation cart from central supply room. Check that all necessary materials to carry out the appropriate isolation protocol are available on the cart, and place correct isolation cart for type of isolation on patient's door to avoid the errors. Ensure that the linen hamper and line waste paper basket are in the room. Explain the procedure or the purpose of isolation to patient and family to have the idea before doing the procedure. Instruct family regarding procedure required for entrance and exit from isolation room to gain more cooperation. So the purpose of this assessment is to prevent the spread of contamination from the nurse to the patient, prevent contamination of the nurse's clothing from the patient, reduce the number of resident and transient bacteria from the hands, prevent transfer of microorganisms from the hospital environment to the patient and from the patient to the hospital personnel. And the last is to prevent any accidental contact of a substance that could carry a blood-borne pathogen with small bricks into the skin. This is the hand washing. Roll your sleeves above your elbows and remove all jewelry and your watch. Do not touch the sink. Turn on the faucet, wet your hands and arms. Avoid splashing the water and hold hands lower than elbows. Dispense liquid or powdered soap onto hands and lather. If bar soap is used, rinse bar soap before and after using. Rub palm, wrist, and back of the hands firmly with circular movements. Interlace fingers and thumbs, moving hands back and forth. Lather hands and arms well. Clean your fingernails as needed with a nail file. Wash each hands and arms for 30 seconds, holding your hands and forearms lower than your elbow. Rinse thoroughly, starting at one elbow and moving down the arm. Then repeat the procedure in the other side of the arm. Dry hands thoroughly from fingers to forearms and arms. Most facilities provide paper towels for this purpose. Blotting with paper towel is easier on the skin than rubbing. Discard paper towels in proper receptacle. Use a dry paper towel to turn off the faucet if it is hand operated. Next is the putting on of masks, gowns, and gloves. Position masks over mouth and nose. Bend the mask nose bar over the bridge of your nose. If you are using a mask with string ties, tie the top string around your neck and the bottom string around your head. There should be no gap between mask and face. Take gown from isolation cart. Grasp gown by collar, allowing it to unfold. Place arms through sleeves and pull gown over shoulders. Fasten neckties, overlap the gown at the back and fasten waist ties. Take clean gloves and do opening gloving. Slip fingers into the opening and pull gloves up to gown wrist. Repeat this step with the second glove. Is the removing contaminated gloves, gown, and mask. Remove gloves by pulling them over your wrists and fingers until each glove is turned inside out. Untie waist ties and let hang freely. Untie neckties and let gown fall forward off your shoulders. Slide arms out of the gown working from the inside. Holding your gown away from your body, fold contaminated side of gown toward the inside. Discard gown if it is disposable. If gown is reusable, hang it in the appropriate place. Remove and discard mask. Wash hands after leaving the room. Next is the removing items from an isolation room. Close the half to 3/4 full of contaminated bag inside the isolation room. Set up a new bag for continuous inside the room. Have someone outside the room to hold a clean bag cuff over his or her hand. If no one to help, assemble a clean bag in a hamper stand before you go into the isolation room. Position the hamper stand outside the room for easy access. Place the contaminated bag into the clean bag being held by another person or in the hamper outside the room. Be careful not to contaminate the outside of the clean bag. Close the clean bag and mark it isolation. All items are contained in isolation bag to be returned to CSR are listed on the tag which is placed on the outside of the bag. Next is the transporting patient outside the room. Explain the procedure to the patient. If patient is being transported from a respiratory isolation room, tell him to wear a mask for the entire time the patient is out of the isolation room. If patient is being transported from a wound skin, gastrointestinal, strict isolation or protective isolation, cover transport vehicle like a wheelchair with a clear sheet before you enter the room. Help the patient into transport vehicle. Cover the patient from shoulder down with a sheet. Tell the receiving department what type of isolation the patient will need and what precaution the hospital personnel should follow with the patient. When the patient returns to the original isolation room, help him or her into the bed. Cover the transportation vehicle with a clean sheet and remove it from the room. Instruct all hospital personnel to wash their hands before leaving the area. Clean the transportation vehicle with an antimicrobial agent. Next is the evaluation. Inspect hands and nails for cleanliness to ensure that the client is clean. Ask client to explain risks for infection based on the condition and determine if intervention should be revised. And determine whether the goal of preventing or reducing infection are achieved to know that the patient is satisfied doing the procedure or the assessment. And evaluate the comfort of the patient after the procedure and evaluate the effectiveness of the technique towards the patient to have the idea in doing the procedure. The last is the documentation. Document the procedure performed and the reaction of the patient to know his or her reaction while doing the procedure or the assessment and to have the record and legal purpose in the near future. So that's all and thank you for watching.